Good afternoon and welcome to 3 o'clock with SAC. I'm Marisol Diaz, Communications and Digital Manager. Give me a second while I welcome our Spanish-speaking neighbors. Buenas tardes, soy Marisol Díaz, gerente de comunicaciones digitales y bienvenidos a 3 en punto con SAC. Si quieren acceso al programa en español, favor de marcar el número que aparece en la pantalla, que es 646-749-3122 y cuando le contestan la llamada, marque la contraseña que es 779-328-221. Si quieren ver episodios pasados, los pueden buscar aquí en nuestro Facebook en la sección de videos y también en YouTube. All right, now I'll go ahead and pass it over to the moderator of the day who will introduce today's topic.
Hello, everyone. Welcome to 3 o'clock with today. My name is Marlene Zaron. I am the Public Health Coordinator here at the Southside Organizing Center. So I just want to give a shout out to Marisol, who's in the back doing production. You guys just saw her give us that nice introduction. I just want to quickly say that the SOC staff and our platforms are currently still available to the public virtually. We are not doing in-person work because of the pandemic. You can definitely contact us with questions regarding resources during this unprecedented time. You can call 414-672-8090. You can also check out our website at www.socmilwaukee.org, and you can email us directly to soc@socmilwaukee.org, where we will answer all of your questions that you have regarding COVID-19 resources regarding mental health, resources regarding food, anything that you need, we got you. So that being said, we would love for individuals to complete our SOC survey. Our SOC survey is located, the link is located in the comments section. Essentially, it helps us gather more information on how we can better the forum and how we can alter it to answering all of your questions and topics of your interest. So all of SOC staff are currently working virtually from home. So that's why you see me at home. I'm not wearing a mask. It's to essentially, if I was in the office, I would be wearing a mask, but I'm at home. So we love to know who's here and who's currently watching, who our dedicated viewers are. Say hello in the comments section. Put your favorite emoji. We love to see it. So just a quick disclaimer that the views and opinions shared today, they do not necessarily reflect those of SOC. That's just something I have to say before we begin. Today is the COVID-19 day, so every Thursday we do have this segment, and we do talk about COVID-19 updates or any amazing updates within the community regarding public health. So our feature segment for today is going to be Dr. Perez. Dr. Perez is the Vice President of Behavioral Health for 16th Street Clinic. She is obviously from 16th Street Clinic. And she is going to be coming on today to talk about the new 16th Street Clinic focusing on behavioral health on National Avenue. So she's going to give us all the details and programming regarding that. Just a quick reminder that tomorrow we are having Carrie Cooper, who is the principal transportation planner from SWERPC. So that being said, I want to bring on our guest today. She has an amazing PowerPoint for us, and she's going to kind of give us all the resources and information about this new clinic. Hello, Dr. Perez.
Hi, how are you, Marlene?
Great. Thank you for coming on today. I know you guys are super busy promoting this new clinic and getting all of our stakeholders within the community to be more aware about it. So we now want our, community members to just be more aware of it, because this is going to be an amazing resource and easily accessible to, community that really needs it during this time. So I'm going to give it to you, and you can go ahead if you want to share your screen, and I'll let you know if it's working.
Sounds good. Thanks again for having me today. Like Marlene just introduced me. That was a nice introduction. My name is Maria Elena Perez. I'm Vice President of Behavioral Health at the 16th Street Community Health Centers, and I'm a psychologist by trade. And just wanted to talk with you a little bit today about our new site, our new building at 1635 West National. So we're really, really excited about this, and I can't wait to tell you all about it. So with that, I'm going to try to share my screen so that it can help guide my presentation, and I definitely want to make room at the end for any questions you might have. So let me just get on here. Let's see, share screen. Oops. Okay, oops. Can you see this, Marlene? Oops. Can you hear me?
Yes, I can. Can you hear me?
Yes, and you can see my presentation?
Yes, it's perfectly clear.
Perfect. Okay. So this is my first slide. Like I just said, we have a brand new building on National Avenue, and we're very excited to tell you all about it. So just as a way to ground the presentation, I want to remind everyone of our mission here at the 16th Street, which is to improve the health and well-being of Milwaukee and surrounding communities by providing quality family-based health care, health education, and social services free from linguistic, cultural, and economic barriers. And you know, the key here really is family-based healthcare. I really love this mission, and I can honestly say so many of the staff and providers at the 16th Street are really driven by this mission. We tend to attract mission-minded individuals to our clinic where they love the work and they just enjoy the people in the community. So that being our mission, maybe giving a little bit of history of the 16th Street Community Health Center. We've been around since the late 60s, providing, leadership in primary health services on Milwaukee's South Side. And, we've expanded, and I'll talk a little bit about that. We're currently operating at 16 locations, including 4 full-service medical clinics and women, infants, and children, or WIC, nutrition program. We also have behavioral health services at our Chavez location, Parkway on 20th at Oklahoma, nearabouts there. We have a Waukesha clinic, and we also have a clinic on 27th and Layton, which I'll talk about here in a moment. And then finally, making mention here today of our national clinic, not to mention some of the school-based services that we are now branching into, deploying mental health providers into the school system here in Milwaukee. So we're really excited about that. So our work, we've been doing behavioral health for quite some time. I know all about that. I've been here since the very, very beginning of behavioral health. I came on board in the late 90s, and we became certified to do outpatient mental health in probably 1998. 97, 98. So we've been working in our behavioral health department, not only doing outpatient psychotherapy and mental health services to our community, we have also been grounding our work with bearing in mind the important aspects of social determinants of health. So we know that it's not just treating mental health issues. It's certainly looking at the individual's psychosocial needs, their situations in life, aspects like poverty, housing, employment, and those kinds of factors we know affect mental health very, very profoundly. We're providing behavioral health care for all people of ages, people of all ages, including traditional psychiatry or medication management, psychotherapy services, substance use counseling and treatment. We are also providing something called MAT. Some of you might be familiar with medicated assisted treatment. And we also have a bilingual child and adolescent day treatment program at our Layton location. So we're very excited about that, being able to help our children and our adolescents who present with high risk problems. And we really try to help those individuals more intentionally as they're struggling a little bit harder than a lot of the kids that we see in our communities. Our impact is well known. We're very, very proud of how many patients we've been able to serve. Each year, roughly, we are serving close to 40,000 visits each year, and close to 6,000 patients served. And that number, of course, keeps growing because we are expanding our services and also adding new providers to make sure that we are giving the proper access, the best access to our community members. Currently, we have, I think the last I counted was 54 behavioral health providers across all of our locations. And that team of behavioral health providers includes prescribers, which are comprised of psychiatrists and nurse practitioners. We also have psychologists, psychotherapists, and substance use therapists. So with that all said, I would like to talk a little bit about our new National Avenue Clinic, which we are so, so excited about. We regard it as sort of just the new jewel of the neighborhood, and it's embedded right there with its doors wide open to our community members, ready to serve. At that National Avenue location, we are going to be providing, or I should say we are providing because we opened our doors just early this week, actually. We are prepared to provide outpatient behavioral health services, substance use services, and also our new service line of comprehensive community services, or CCS. Now, CCS is brand new to the 16th Street Community Health Center, and it's going to be providing care coordination to our consumers who struggle with mental health issues, which is really going to open up doors to the various different kinds of activities that they can engage in to improve their mental health. I want to just also talk a little bit about the services we'll focus on there at the National Avenue location. There's our lovely Melissa Waldo. Some of you might even know her. Talked a little bit already about psychologists, psychiatry, psychotherapy, and marriage and family therapy. We work with a broad array of mental health problems, spanning from depression, stress, anxiety, ADHD or ADD, a broad range of emotional issues, post-traumatic stress disorder. We certainly see our share of trauma-related disorders in our clinic, and some psychotic disorders and bipolar 1, bipolar 2 disorders in our clinic. And there I am on the slide for providing substance use services. We are certainly aware of the growing number of concerns in our communities related to addictions. We are really especially facing an increase of addictions right now during the pandemic. In fact, mental health disorders in general. So with our treatment program for substance use disorders, we provide services for assessment and evaluation, individual group psychotherapy, codependency groups, relapse prevention, and of course, I've already mentioned the medication-assisted treatment, which, by the way, is an effort that is put forth by our medical providers and our behavioral health providers alike. So it's a nice way that we are integrating our care and providing this service, this MAT service, blending our medical staff and our behavioral health staff also. As I mentioned earlier, we are also going to be providing comprehensive community services, which, by the way, I am told we've already got some nice numbers. A lot of consumers are already signing up for CCS through our National Avenue location. It is an added layer of support for adults to help manage their day-to-day mental health needs. And those CCS services could include peer support, help with employment, nutritionists, and other wellness activities like yoga, meditation, equine therapy. The list goes on and on. Just a lot of other things that you would not normally expect of, services provided through a mental health clinic. But CCS is going to help us to expand those services so that our very deserving community members can get those services through CCS. To qualify for CCS, consumers need to be over the age of 18, enrolled in Medicaid, and they should want and are ready for help. This is a voluntary program. They have to want to be in the program, and they should be referred to CCS through their behavioral health provider. And I'm told that they can also be referred by their primary care doctor as well. So we also want to include our friends at the Behavioral Health Division through Milwaukee County. They are going to be moving in and become co-located here at our National Avenue location. This is a really special time for providing behavioral health services, and it's just very exciting to have BHD come and join our 16th Street building here at 1635 West National. And BHD staff will also be providing care coordination and team connect teams housed at our National Avenue clinic. So it's a nice way for BHD and the 16th Street to provide sort of seamless care to our community members. So if you'd like to connect with us, I'd like to invite you to make an appointment at National Avenue or with any of our 16th Street behavioral health professionals by calling 414-672-1353. And just very excited not only to connect with you for appointments, but also for presentations like this. We're very excited about spreading the word so that people can know about us and we can extend our reach. So thank you so much. I'm going to stop sharing my screen now, and I'm going to go ahead and, invite everyone or anyone who has questions as part of this presentation. Let me just end here.
Awesome.
Yeah. Thank you for listening.
Yeah, definitely. This was really informative for, those that haven't seen the presentation yet. I've seen it twice already, and I think it's really good for, many individuals during this time to seek out mental health care because, there's a huge stigma within the community regarding getting mental health care, and that's something that needs to be broken down slowly. But the more people we get to actually go forth and use these types of services, the more people will realize mental health care is just like taking care of your normal health.
Yes.
Yeah,
you're absolutely right, Marlene. People have to take care of their mind as well as their body. And I think that, of course, I'm biased. I'm a psychologist, but I think I know a lot of doctors and other people of different walks of life that know this to be the case. It's true. One's mental health is very, very important, and we have to guard that. And when you're talking about stigma, that's a very important topic because a lot of people don't want to get help because they feel that, van a pensar que soy loca, they're going to think we're crazy, or I should be strong enough to handle this, or other people have it worse than I do. These are things that I hear from time to time that keep people from getting the help they need. And the bottom line is all of those things keep us from getting the help we need. And we should really be connecting, especially now with the pandemic. We've been providing behavioral health services almost for the past year via telehealth and telephonic visits. I'm happy to tell you that we've been opening our doors now, and our providers are now in clinic and accepting patients gradually. We're seeing them face to face. So we've got to connect, and we cannot allow stigma to keep us from getting the help we need.
How have you seen, because the clinic just recently opened, have you seen there's been like a huge flow of individuals coming in, or have you seen because of like the pandemic? Have you seen people being hesitant to go?
A little bit of both. I am going to tell you, and we just opened our doors Monday, but even I can tell you right now, those visits are taking place. Layton or not Layton, the National Avenue site. It's up and raring to go. It's ramping up already as we speak. I already have a prescriber seeing patients. CCS is up and running. Very shortly, we'll have 2 substance use disordered providers who provide treatment for addictions. They'll be on site in March. So it's just a really exciting thing. But I can tell you that getting back to your question about the pandemic, people have been afraid to come out since last March or April. And like I said earlier, we've been providing those services via telehealth or, televisual and telephonic visits. However, at the same time, people right now are ready to come back. We are excited that, there's talk that the vaccines are now going to become available to our community members. We're learning more and more about how to stay safe and how to run our clinic in ways that are going to keep everybody safe, providers and patients alike. So people definitely recognize they're desperate for the help. They want to come in. And those who are not wanting to quite come in yet, they're still available. There's still help available to them as well.
Yeah, that's amazing. 16th Street Clinic has been doing lots of work for mental health from the beginning. I know you guys transitioned very smoothly into the telehealth, movement that a lot of other individuals are doing, but I believe you guys were the very first that put that into effect.
We were, that what you just said, we've been very blessed, Marlene. Many Milwaukee clinics, they were struggling with the same thing. We sort of were floating in the ocean of ambiguity. We didn't know how to best proceed, but we all supported one another. People across the state, people even in Milwaukee, we've had wonderful relationships with other clinics, and we've all sort of had to sift through it together.
I have a question. Do you need to live in the city of Milwaukee in order to have access to telehealth services or the mental health?
Wonderful question. Yeah, I can tell you that we have been seeing, because of telehealth, and it's opened doors not only in Milwaukee and Waukesha County, but we have been seeing folks from other counties in the state of Wisconsin, because telehealth has opened those doors. So the name of the game here, and I will say this because I take very seriously, I feel accountable to the community. And I want to, when I say access, it's access to people who need it, right? So they might not live in Milwaukee, and I would want us to know that the 16th Street Clinic is really about opening its doors to those who need it, right? And we know that more than ever now, with just so much despair for a variety of reasons, it's been a tough. 2020 was tough, and but it's going to be a while before things normalize, I think. We will be opening more and more, just like other clinics will be opening. It's expanding that access to services, and it would be open to. So, for example, somebody from Milwaukee can be seen in our Waukesha clinic if there was a provider there they wanted to see, for example.
Okay, so I don't know if you know Andrea Rodriguez, but she said, "Thank you, Dr. Perez. I loved your leadership when I worked at SSCHC years ago. Thank you for all that you do."
Oh, Andrea, thank you. Thank you so much. That means everything.
Yeah. So quickly, does 16th Street Clinic serve those that are undocumented?
Yes, Marlene, we do have, and I don't have those numbers with me, but we do serve patients who are undocumented. We do so discreetly, and cautiously, because we know that's a sensitive, that there's fear around that as well, right? So, and we've been doing that for, as long as I've been working there, which was in the mid to late 90s. I've been there, and we've been able to help those who do not have citizenship.
Awesome. And how does this clinic play in place to individuals that, let's say someone who has some mental health issues and the family they're living with, their family members are noticing this person is currently having an episode right now. How can someone approach that, and how can someone ask for help through your clinic for that? Or is that, what pathway would they have to
Right.
go?
Yeah, we recognize through your question that it can be tricky when it's an adult who doesn't want help, right? Because sometimes, a family member is in despair, right? They don't know what to do. They don't know how to help their loved one. That phone number, 414-672-1353, the help is there. Though while we're not a crisis center, we certainly have our share of situations that need immediate attention, right? And we invite people to call us to try to get the help that they need to convince their family member to come in. I had a situation a couple of weeks ago where it was and so when you have a grown child who doesn't necessarily want the help, yet they are in despair, they're maybe using drugs or drinking excessive alcohol. And, the parent called and said, I don't know what to do. And, we actually got him in, and he was able to see a provider the very next day. So we do have those openings. And sometimes they reluctantly come in, and they find that it's not as bad as they think, or it's not as scary as they think. It's about change management. It's about motivational interviewing is what we call it. We really try to engage those ambivalent people who aren't sure about seeking treatment. We are here to help, and we want to get them invested and convinced to come in and get that help.
Right. I totally agree with you on that. Behavior change is something that has a huge effect on getting individuals to kind of realize that they do have a problem, and then eventually, go in and try to seek out that help that they need. I actually have a brother who is like that right now. Kind of stays to himself and in his room all the time, and and we pretty sure he's using some type of drug. But yeah, I haven't been able to kind of like get to him. He's kind of in denial of the whole issue, and he doesn't want to be labeled if he does go in to see a mental health provider.
Getting back to that stigma you were talking about earlier. Yeah. And how hard it is for the family, right? Sometimes families come in even though they can't get their family member that really needs it. Sometimes the family comes in for help because they're dealing with powerlessness. And how do I deal with a family member whom I love who doesn't want to get help? And then we're there to support the family, you know? And I hear what you're saying, Marlene. My daughter's 24, and I've said this before, and I have her permission. She struggled with addictions for many, many years, and happy to say that she's been clean 3 years. And but it wasn't easy as a parent to struggle with trying to get her to the help, and she wouldn't do it. And sometimes you have to watch them hit rock bottom. But love is the strongest bond we have, right? Not only in family, but in community. And we cannot give up. We cannot give up on people ever. So I just encourage anybody out there with a family member who has an addiction, who has depression, post-traumatic stress, never give up. I know that it's easy. Well, I shouldn't say it's easy. I know that you reach a point where you want to because it's frustrating. But get the help you need so that you can get support in knowing how to deal with a family member you love who doesn't want that help.
Right. Well, that's awesome. I will have my mom call your services.
Please do that, please.
Yeah, definitely. So quickly, right before we end, many individuals want to know if there's a cost to this service. Can you explain that to individuals?
So the 16th Street behavioral health providers, most of us are on many, if not most, insurance panels. So don't let uninsurance or Title 19 be a barrier. We do take Title 19, and we also have a sliding fee scale for those who don't have insurance. So it's very, very affordable. I know that the 16th Street works with you. They work with its community members because we recognize that really a healthy community is defined by, it's the willingness to sort of cover all members and, working with those members that may not have the resources, but there's always a way that can be paved to get somebody there. But so we have sliding fee insurance. And those sites. We also have financial counselors, by the way, Marlene, who can certainly walk alongside an individual who wants to get help, and they can help explain those options better.
That's awesome. Thank you so much, Dr. Perez. It was a pleasure having you on and explaining all of that to individuals.
Well, the pleasure is mine, and I thank you so much for listening and also the invitation.
Definitely. Thank you.
Okay. Take care, everybody.
Thanks. All right. That was an awesome interview from Dr. Perez. Got a little bit emotional there, sharing some information. It is hard, dealing with a family member who doesn't want to seek out help, even though you're, constantly trying. So yeah, definitely seek out 16th Street Clinic, behavioral health clinic on National Avenue. They're located on 1635 West National Avenue, and you can give them a call at the 414-672-1353, and you can ask for more information or ask a nurse to help you out. So now I have a interesting video for you guys. It's about one of our UWM interns. She had COVID-19, and she is going to share her story with us.
Hi, my name's Peyton and I'm 19 years old. I live alone on the UWM campus, but I'm doing school virtually right now. I contracted COVID-19 about 2 weeks ago. I am not aware of how I contracted COVID-19 because the only places I really go are to work in the grocery store. My symptoms first started off with a sore throat, and I thought I had strep throat. I got tested for COVID and strep, but tested negative for both. The doctor put me on an antibiotic anyway, but after still feeling sick days after, I was recommended to get tested again, and that is when I tested positive for COVID-19. The doctor said that there are a lot of false negatives because so many people get tested too soon for COVID-19. My symptoms included a cold, sore throat, and for 3 days I had a fever of 102. I also lost my sense of taste and smell, but essentially COVID-19 sometimes is not activated in the system until a few days after exposure. The correct timeline when exposed to COVID-19 is that you should get tested once, and if negative, you should quarantine for 3 to 4 days and then get tested again. This reassures your COVID-19 status. During my 14-day quarantine process, I stayed home for all of the 14 days. I filled my time with school, FaceTiming friends, cleaning my apartment, and mostly getting rest. I would order my food through delivery companies and had one of my friends bring groceries to my apartment door. Mentally, it was very exhausting, and I was lonely having to be by myself for the 14 days. I would suggest that you schedule some Zoom calls with friends and remember to do self-care during this time. Also, fill your time watching movies and shows even though you're feeling sick within the 14-day period. Now that I'm done with my quarantine after having COVID, I still have a loss of smell and taste. Not sure when this will come back. I'm lucky to have this as my side effect of COVID because one of my friends, about 20 days after quarantining, developed a rash on her face and was told it was from an after symptom of COVID-19.
All right, so that's a great video. Thank you, Peyton, for creating that for us. And now we have a civic update for you guys.
So I also just want to take this opportunity to show you the My Vote Wisconsin website where you can register to vote and request your absentee ballot online, just myvote.wisconsin.gov. You can change it to Spanish by going down to the bottom here, not all the way to the bottom, but pretty close. And it says Español here, so you can change it to Spanish. But this is where you can, like I said, register to vote or vote absentee, learn where you vote, and even get a sample ballot to see what's on your ballot. So let's hit register to vote to see what that looks like. You'll just put in your first name, last name, and your date of birth, and it will guide you through just a series of questions. It takes just a few minutes, and it's easiest if you do it on your phone, because then you can just snap a picture right away of the identification, passport, license, whatever you have, because that is required when you register to vote. So just keep that in mind, unless you have on your computer already a file of an image of your identification. But it's pretty easy by phone. And same with the vote absentee option. So it'll ask you to put in your first name, last name, and date of birth to confirm your voter registration, and then guide you through the process of requesting the absentee ballot. Again, super short process. I did it in like 5 minutes for the spring election. And you also might have to upload an image of your identification. So just keep that in mind if it makes sense for you to do it by phone or by computer. And so that's that, and I hope that was helpful. I will now give it back to Tammy.
All right, well, I'm not Tammy, but I'm Marlene. So that was a great civic update that we have. And now I'm gonna kind of go through here and see who else said hello. We have a hello from Charlie and hello from Drea. Thank you guys. And now we have a SOC feature. We have a nurse, Crystal Sanchez, with us. Hi, everyone. My name is Marlene Zaran, and I am the Public Health Coordinator for the Southside Organizing Center. Today, we're going to cover heart health in the United States. I have with me Crystal Sanchez, a nurse at Freud Hospital, and she's going to kind of give us an update about heart health since February is Heart Health Month in the U.S. So Crystal, can you explain to us what are some heart health facts we should know about the Black and Latino OAX community in the United States?
Yeah, so according to the CDC, heart disease is the leading cause of death in both Black or African American non-Hispanic population and the Latino X community. About 20.3% of Hispanic males get heart disease in the United States. In Wisconsin, men live an average of almost 5 years less than women. This is very similar to the situation for men and women in the rest of the United States.
Okay, awesome. Thank you for sharing that information. Mm-hmm. So quickly, one more thing we'd like to know is, what is coronary artery disease or heart disease?
Coronary artery disease, also known as coronary heart disease, or simply heart disease, involves the reduction of blood flow to the heart muscle due to buildup of plaque in the arteries of the heart. It is most common of the cardiovascular diseases. The types include stable angina, unstable angina, myocardial infarction, and sudden cardiac death. A common symptom is chest pain or discomfort, which may travel into the shoulder, arm, back, neck, or jaw, and occasionally it may feel like heartburn. which is commonly seen in women. Usually symptoms occur with exercise or emotional stress, last less than a few minutes, and improve with rest. Shortness of breath may also occur, and sometimes no symptoms are present. In many cases, the first sign is a heart attack. Other complications include heart failure or an abnormal heartbeat.
Oops, I was muted. Thank you for sharing that information with us, Crystal. We appreciate your time with us, and we thank you for coming on.
Thank you.
All right, great updates from Nurse Sanchez. So now we have your SOC survey promo.
Has this live forum been informative and useful to you? What part of the forum could be improved or changed to make it better? Please take a quick survey that's located in the comments section so that we can keep 3 o'clock with SOC going for residents. Thank you for tuning in.
All right, so just quick reminders for tomorrow. We have Carrie Cooper. She is the Principal Transportation Planner from SURPAC. Quickly, I want to send out my solidarity with protesters and families, and thoughts and prayers to those that have been affected by COVID-19, especially illness and death. So that being said, I hope everybody has a great rest of your day, and we will see you guys tomorrow. Here are some funder partner thank yous.
Hello, viewers. I am Esperanza Gutierrez, a longtime resident of the near South Side. We would like to thank everyone for supporting our 3 o'clock with SOC live show and for completing our SOC survey. In addition to thanking our residents for tuning in and sharing our show, we would also like to thank the following sponsors: Wisconsin Voices, Community Development Block Grant, Neo Philanthropy State Infrastructural Fund, the Movement Voter Project, the Catholic Campaign for Human Development, the Silber Foundation, City of Milwaukee Office of Violence Prevention, the Tithe Foundation, the City of Milwaukee Promise Zone, and all the faithful individuals who support SOC through their personal donations. Thank you. Gracias.